Assalamu alaikum. My name is Naula. I am the student of MS Chemistry, University of Management and Technology. Today, my topic of presentation is brain-related diseases. In this topic, I am discuss about different type of brain diseases. What are the causes of these diseases and what are their treatment? First of all, I am tell about what is brain. Brain is the most complex organ in our body and to transferring of messages in our from one part of body to another. The brain is made up of two type of cell. These are called neurons. These are called neurons and the glial cell. The neurons are the basic working of brain and nervous system, while the glial cell are the supportive cell of the transferring of these messages between the neurons. The constant exchange of messages between neurons is called neurotransmission. Some neurons send messages in the form of a chemical signal or called neurotransmitter, and others send an electrical signal. A neural circuit formed by many neurons working together and multiple circuits from a region of the brains. When the neurons transferring these messages through chemical signal, neurotransmission can occur. Neurotransmission work on four basic principles. These four basic principles. Number one, first of all, it activates the neurons. Second one, when the neuron is active, it further transferring these messages between other neurons through synapses. The synapses is called the tiny gap between two neurons. The third one is it bind a receptor between the receiving cell and the donor cell. Fourth one is the binding process that neurotransmission messages pass. When the binding site is occurring, the neurotransmitter transferring these messages to the receiving cell. When these process neurotransmission such as neurotransmission is not work properly, we can say that there is a mental illness or brain disorder. These include Parkinson's diseases and depressions. There are different type of brain diseases. I can explain this one. This one is the brain structure. These are different part of our brain. One is called cerebellum, cortex, cranium, basal ganglia, brainstem, spinal cord. Spinal cord is the another one. When these structure is brought out, these are different there are different part of our brain. One is called occipital loop, parietal loop, frontal loop, and temporal loop. When these phenomena are abnormal, we can say that there is a brain disorder. The brain disorder may be occurring through parental loop, occipital loop, frontal loop, or temporal loop. I can explain these are different type of brain diseases. One is called the neurodegenerative diseases, and other one is a neuropsychiatric disease. Neurodegenerative diseases include Parkinson's diseases, Alzheimer disease, multiple sclerosis, viral diseases, SMA or SCA. SMA is abbreviated of spinal muscular atrophy, and SCA is the abbreviated of spinal cerebellar ataxia. These and further one is a neuropsychiatric disease. This one includes seizures, anxiety, neurodegenerative impairment, neuropathic pain, mania, physical disability, addiction, epilepsy, and mood disorder. These include, for example, the brain cells affected by dementia are less active and have a lower glucose metabolic rate than abnormal cell occur. Area of decreased glucose metabolism may also indicate the area giving rise to seizures. In short, when the glucose level is increased, then the metabolic rate also cause disease, and when the glucose level is low, then also can cause a disease. This one is called seizures. Decreased oxygen use and blood flow may indicate stroke. When oxygenated blood flow does not flow properly, these can cause a stroke. This one is also a brain disease. Abnormal pattern of glucose metabolism and accumulation of myosin may signal the presence of brain tumor. And What are the causes of brain disease? Brain tumor. Brain tumor is occurring when our glucose metabolism and accumulation of amino acid may signal the presence of brain tumor. We can say that brain tumor, how brain tumor occur? Brain tumor occurring through glucose metabolism and accumulation of amino acid. Further, molecular imaging has become a part of standard care of for brain cancer. Molecular imaging MI has become a part of standard care of for brain cancer, assisting a physician in stages, determining extent of diseases and in detecting recurrence. One of the most active use of neuroimaging, it is the study of brain circulatory. The interconnected brain cell are neurons that constantly exchange messages in a process called neurotransmission. Many mental illness and other brain disorder are linked to a disruption in the brain circulatory. Understanding how a neurotransmission synapses and circuit are altered in people with the brain disorder is critical to developing new treatment and prevention strategies. When the active area of research in the use of molecular imaging for Alzheimer's disease (AD), new radioactive are being developed that offer the potential to detect the AD in the early stages. Stroke. One of the disease of our brain is a stroke. Stroke happen when blood flow to a part of the brain is interrupted because a blood vessel in the brain is blocked or burst open. These are the causes of brain disorder, stroke. When our blood vessel is not work properly or interrupted in the brain is blocked or burst open, brain cell is deprived of blood and oxygen can die, causing a permanent damage resulting in weakness or paralysis of an arm or leg or problem with the speech. Stroke is the third leading cause of the death in United States. But it means that stroke is occurring in United States mostly. A stroke is a medical emergency. Intermediate treatment can save lives and reduce disability. Person experiencing and symptom of a stroke should have a complete physical and neurological exams. CT and MR imaging or nuclear medicine technique are used to determine this type. Then the CT is abbreviated of a computerized topography, and MR imaging is the microscopic resonance imaging. The nuclear medicine to detect these type of diseases called stroke. The location and cause of the stroke and to help rule out other disorder. These are the three type of stroke. One is called ischemic stroke. Second one is hemorrhage stroke, and third one is the transient ischemic attack, TIA. In this figure, we can see that in ischemic attack, our blood vessel or block the nerves, and other second one is hemorrhage stroke. Our blood vessel burst out, and third one is transient ischemic attack. Our blood vessel or block the capillaries of our brain. Second one is how does the molecular imaging help people with the stroke? Respect imaging and the radio pharmaceutical TC9M is the most frequent nuclear medicine technique used for stroke detection. When we are detecting the stroke, these are two phenomena to detect the stroke. The one is the SPECT and other one is the TC99M radio pharmaceutical. In addition to detecting the acute stroke, the SPECT is also used in the evaluation of patients who have had a stroke and a transient ischemic attack, TIA. These are the type of stroke. One is transient ischemic attack. Second one is hemorrhage stroke, and third one is the ischemic attack. During a TIA, which is also known as a mini stroke, an individual experiences stroke-like symptom that last for a minute up to several hours. These symptoms can occur through a minute to several hours. Also, TIA do not typically result in the permanent brain damage. While in a TIA, transient ischemic attack, our brain does not damage permanently. Physical of the often used SPECT to determine which part of the brain may be at risk. These are the treatment of our brain disorder, stroke. Anti Number one is aspirin. Aspirin is dosage vary from person to ages to ages. Aspirin is 160 to 325 mg per day, accurate then 80 mg per day. Indication all acute है ये. Aspirin diparacetamol combination aspirin 25 mg plus extended release diphenhydramine 200 mg per day. Third one is the clopidogrel 300 mg per day acutely, then 75 mg per day. Stroke prevention in patient with aspirin allergy. The third one is the heparin parental to target PTT. Warfarin dose to target dabigatran 150 mg twice daily. The other disease, other brain disorder is dementia. Dementia is the syndrome that involves memory loss. Further one is it is a disease of memory loss and decline in intellectual functioning that is the serve enough interfere with the individual's ability to perform routine tasks. More especially, it involves impairment in two or more areas of thinking and mental ability. For example, chronic forgetfulness, planning, organizing, and decision making and confusion. These are the symptoms of our dementia. A decline from prior level of functioning that interfere in daily life, such as work routine, driving, organization task, and preparing meals. These are the function of our dementia. Common symptoms of dementia include memory changes that disrupt daily life. Number one is the changes the daily life. Second one is the planning of our problem solving. Third one is the different completing familiar task. Fourth one is the confusion with the time and place. Fifth one is the trouble understanding visual images and spatial relationship. Seventh one is the new problem with the word in speaking and writing. Misplacing thing and losing ability to retrace step. Decrease or poor judgment, withdrawal from work or social activities, change in mood and personality. These are the causes of, these are the symptoms of dementia. To forget, basically it is a memory loss disease to forget of our daily routine. Dementia is detected through multi-step process that include a patient medical history, are shared by both patient and knowledge information such as family member, and an objective assessment by healthcare professional including a mental status evaluation or clinical examination laboratory test. There are three types of dementia. Number one is Alzheimer disease. It is the most famous disease of our brain, the most common cause of dementia, accounting for about between 60 to 80% of all cases. For more information, however, there are more than 80 different disorders that cause dementia or stimulate dementia. Dementia is sometimes the result of degenerative diseases that are progress and cannot be stopped. However, some cause of dementia may be treated and reversed. Alzheimer, these are the picture explain. These are the normal cell and these are the Alzheimer disease. This one is the normal cell and this one is the Alzheimer disease. Figure A show that the control cell show that there is a gap between a cell, and Alzheimer disease there is a large gap between cell, and there is disrupt or burst out the nerves. This figure and figure B explain there is a disruption of our nerves in our brain cell. These are the MRI of our brain. The second type of dementia is vascular dementia. Vascular may arise as a result of cardiovascular diseases in which the flow of blood to the brain is limited or non-existent to certain areas of brain. Vascular dementia is often the result of multiple stroke. It is estimated that nearly 1/5 of people who suffer a stroke will develop problem in involving their mental abilities. Vascular dementia is responsible for approximately 20% of dementia cases. Approximately 10 to 20% of American over ages of 60% experiencing dementia have, making it one of the leading cause of dementia along with Alzheimer's disease. It means that Alzheimer's disease is most cause of dementia, while that vascular dementia is caused through a blood, not a flow of a regular blood flow in our brain, and it is mostly occurring through a further is dementia, an umbrella term used to describe a range symptom associated with the cognitive impaired. It means that Alzheimer's disease occurring 50 to 75%, vascular disease occurring through 20 to 30%, Lewy body disease is occurring through 10 to 25%, and other one is minor amount. Lewy body dementia, it is also a type of dementia disease in which a memory loss, LBD affect an estimated 1.3 million individual and their family in the United States alone. Because the LBD symptom may closely resemble other more commonly disease like Alzheimer's disease and Parkinson. It is widely underdiagnosed. LBD is umbrella term for two related diagnoses. It refers to both Parkinson's disease dementia and dementia with Lewy bodies. The earliest symptoms differ but reflect the same underlying biological changes in the brain. Over time, people with both diagnoses develop very similar cognitive, physical, sleep, and behavioral symptoms. Early diagnosis treatment of LBD may extend quality of life and independence. Many people with Lewy body enjoy significant lifestyle improvement with a comprehensive treatment approach, and some may even experience little no change from year to year. LBD symptom, Lewy body dementia symptom include problem solving, planning, and abstract or analytical thinking. Cholesterol inhibitors, medication originated well for Alzheimer's and or the standard treatment today for cognitive LBD symptoms. Cognitive fluctuation involve unpredictable changes in the concentration and attention from day to day. Parkinson-like symptoms include rigidity or stiffness, shifting gaits, tremors, and slowness of movements. Sometimes Parkinson medication called LODA is prescribed for these symptoms, and saying or hearing things that are not really present. If the hallucinations are not disrupted, they may need not to be treated further. However, if they are frightening or dangerous, physician may recommend a caution trials the use of new antipsychotic medication. Information for Lewy body disease is Lewy body association. These are the treatment of dementia or Lewy body diseases, Alzheimer's disease, and vascular diseases. Number one is dosage is donepezil. It is a 5 to 10 mg per day, and it is side effect is nausea, vomiting, diarrhea, and vivid. So third one is the glontamine. This amount is 8 to 12 mg per day. It is also side effect of nausea, vomiting, diarrhea, and weight loss and anorexia. Memantine, NMDA receptor antagonist, 10 to 20 mg. Hallucination confusion. In this hallucination confusion include we cannot see anything but we observe. The other type of brain disorder is MATES. It is a popular myth that chemical imbalance in the brain are slowly responsible for causing a mental health conditions. Although chemical imbalance in the brain seem to have an association with the mood disorder and mental health condition, research have not proven that chemical imbalance are the initial cause of these conditions. Other factors that contribute to mental health condition under one is a genetic and family history, a life experience such as a history of physiological and emotional abuse, having a history of alcohol or illicit drug use, taking certain medications, Psychological factors such as external circumstances that lead to feeling of isolation and loneliness. While some studies have identified the link between distinct chemical imbalance and a specific mental health condition, researchers do not know how people develop a chemical imbalance in the first place. Current biological testing also cannot reliably verify a mental health condition. Doctors do not therefore diagnose mental health condition by testing for chemical imbalance in the brain. Instead, they make a diagnosis based on a person symptom and finding of a physical examination. What condition are linked to a chemical imbalance? When these conditions of linked to a chemical imbalance, what are their uh, causes? Research are linked to chemical imbalance to some mental health condition, including depressions. Depression, we can say that depression is simply a link of chemical imbalance to a mental health condition. Depression, also called clinical depression, it is a mood disorder that affect many aspects of our personal life. Some from their thought and feeling to their sleeping and eating habits. Although some researchers link the chemical imbalance in the brain or to depression symptoms, scientists argue that it is not the whole picture. For example, researchers point out that if the depression was slowly due to chemical imbalance, treatment that target neurotransmitters such as selective serotonin or reuptake inhibitors, shock wave fosters. The symptom of depression may vary widely among individuals, but they may include persistence feeling of sadness, hopefulness, anxiety or apathy, persistence feeling of guilt, worthlessness or pessimism, loss of interest is firmly enjoyable activity or hobbies, difficult concentration making decision or remembering things, irritability, restlessness or hyperactivity, insomnia or sleeping too much, causing inappetite and weight, physical ache, cramps, digestive problem, through thought of suicide. These are the symptoms of depression include thought of suicide, physical act, headache, cramps, digestive problem, change in appropriate and weight, insomnia, sleeping too much, restlessness or hyperactivity, difficulty, concentration, making decision or remembering things, loss of interest, formerly enjoyable, persistence, feeling of guilt, worthlessness, persistence, feeling of sadness, helpfulness, and anxiety. It is possible to develop depression at any age, but symptoms usually begin when a person in the teenage year or early 20s and 30s trusted source. Women are more likely trusted source than men in the experience depression. It means that women are most cause of disease than in men. Many different type of depression exist. These include major depressive disorder, MDD, persistent depressive disorder, PDD, psychiatric depression, PD. And the fifth one is the postmortem depressions, and 761 is the seasonal affective disorder, SAD. The dramatic hemorrhage change that take place after giving birth are among of the factors that can increase a woman's risk of developing postmortem depression. According to the National Institute of Mental Health Trust source, 10 to 15% of women experience postmortem depression. Bipolar disorder. Bipolar disorder is a mood disorder. Bipolar disorder is a mood disorder that causes alternating period of mania and depressions. These period can last anywhere from few days to few years. Mania is referred to state of having a normal high energy. A person experiencing a manic episode may explain following characteristics. These include feeling elated or euphoric, having a usually high level of energy, participating in several activities at once, leaving a task unfinished, talking extremely fast, being agitated or irritable, frequently coming into conflict with others, engaging in a risky behavior such as gambling or drinking excessive quantities of alcohol, a tendency to experience physical injuries. Severe episode of mania depression can cause psychotic symptoms such as delusion and hallucinations. People who have a bipolar disorder can experience distinct changes in their mood and energy level. They may have an increased risk of substance abuse and higher incidence of certain medical conditions such as my migraine headache, thyroid disease, health disease, diabetes, obesity, or excessive weight loss. The exact cause of bipolar disorder remains unknown. It means that we cannot know the basic cause of bipolar disorder. Research believe that changing the dopamine receptor trust resulting in altered domain level in the brain may contribute to the symptom of brain disorder. Anxiety. In anxiety, many people experience occasionally anxiety when they face a significant life change, problem at home, or an important project at work. However, people who have an anxiety disorder often experience persistent anxiety or excess worry that worsen in the response to stressful situation. According to the Anchor of 2015 review article, the evidence for neuroscience research suggests that the gamma aminobutyric neurotransmitter may play a crucial role in the anxiety disorder. The GABA, gamma aminobutyric acid transmitters reduce a normal neuronal activity in the amygdala, which is the part of the brain that store and process emotional information. GABA is not only the neurotransmitter that in anxiety disorder involve. Other neurotransmitter may contribute to the this disorder includes serotonin, endocannabinoid, oxytocin, corticotropins releasing hormones, opiate peptides, neuropeptide, and these are the type of different brain disorder. And now I have discussed about the treatment of these diseases. Number one, a doctor can prescribe a class of medication called psychotropic to rebalance the concentration of particular neurochemical in the brains. The other is doctor use these medicine to treat a range of mental health condition, including depression, anxiety, bipolar disorder. Example of psychiatric include selective serotonin reuptake inhibitors, SSRIs is abbreviated of selective serotonin reuptake inhibitors such as fluoxetine, Prozac, cytoplasm complex, and sterline zolofit. Certain neuropinephrine reuptake inhibitor SNRS. First one is the SSRI and second one is the SNRIs. Selective serotonin reuptake inhibitors include fluoxetine, cytoplasm, and serotonin, while the serotonin neuropinephrine reuptake inhibitors including valfaxins, XR, relaxation campability, and this one. Tricyclic antidepressant TCA such as antipyrrolines, allyl depressant, norepinephrine, and neuropamilers. Benzodiazepines include clonazepams, clonopins, and lorazepam ativans. According to 2017, impaired symptom in an estimated 40 to 60% of individuals with moderate to severe depression within 6 to 8 weeks, while some people experience reduced symptom within a few weeks. It can sometimes take a month of the other field to of side effect. Different psychotropic have varying side effects. People can discuss the benefit and risk of these medication with their doctors. Side effect of the psychotropic medication can include dry mouth, hoarseness, headaches, dizziness, decreased libido, worsening symptoms. So I can finish my topic of presentation. These were this whole topic. I covered the brain disorder and what are their causes and their diseases.